O.J. Simpson died of prostate cancer, so I thought it'd be a good time to review prostate cancer. It probably afflicts black men more than anybody, 1 in 6. Prostate's a little gland kind of at the base of the gonads. It is surrounded by the urethra, and the prostatic fluids and the seminal vesicle fluids help lubricate sperm as they go on their way to an ejaculate. But prostates become a problem as men age. They grow larger and they can become cancerous. It's the #1 cancer that men have. Again, more common in blacks, less common in Asians and Hispanics, but still overall the #1 cancer killer of men. What can you do to prevent it? Unfortunately, not much. And while sometimes we joke that ejaculating 21 times a month is a preventative, it's actually based in some science. However, once a man gets prostate cancer, our therapies are limited to several. #1 is surgery. Surgical treatment of prostate cancer is probably the most effective treatment we have, but it is also effective as radiation therapy, which can take several forms. Again, depending on the stage and the grade of your prostate cancer, whether it's gotten outside of the prostate or not, will depend upon the therapy that would be best for you. Unfortunately, erectile dysfunction is a common feature of prostate cancer treatments, all of them. There are things that can be done, and sometimes the erectile dysfunction gets better over time, but that's unfortunately the price that men have to pay for adequate treatment of prostate cancer. Screening of prostate cancer typically begins in the late 40s and early 50s with the prostate-specific antigen or PSA test. It is not a diagnostic test. If you have a high test, then it will be combined with a digital rectal examination of the prostate through the rectum, as well as perhaps other modalities like MRI screening or CAT scan screening, etc. So if your PSA goes up, it's concerning, but a PSA can go up for a number of reasons that are entirely benign. Again, if you have some concerns of this, you should see a board-certified urologist for treatment, care, and diagnosis. As the #1 cancer killer of men, it's something that we take exceedingly seriously, and that we have an array of tools and techniques that we can use to help men, both through their cancer screening and diagnosis, through the treatment of it, and through the recovery and dealing with erectile dysfunction. Our job in cancer is to eventually prevent and treat. So if you start having early symptoms, even if you think it's just benign prostatic hypertrophy, please don't take supplements like saw palmetto because they will not help you. They will not prevent cancer. They will not prevent benign prostatic hypertrophy or a benign enlargement of the prostate. But if you're noticing symptoms, please see a urologist, get tested, because early treatment is the best treatment that we have. Later treatment, we don't have much. But of the final note, it's an old saying that men, if they live long enough, will die with, but not of, prostate cancer. Until then, take care of your prostate. You know how to do it. If you like this, like, follow, share.